Coral Tree Family Service is a statewide tertiary level intervention service for families of children with emotional, behavioural and social difficulties. The children and the families we work with have often been in therapy for many, many years, and these are the rooms in which we meet them with. They're old, tight and frankly a little bit stuck in the 70s.
So our idea is to create an outdoor therapy room that will embrace, enhance and utilise our beautiful surroundings that we have, and it will help to engage families in therapy.
Paediatrics is a very specialised area, and we want to ensure that skilled, knowledgeable and confident staff are caring for our children in hospital.
The paediatric ward has the third highest admission rate for paediatric units in New South Wales. Recruitment has repeatedly demonstrated a lack of available and skilled paediatric nurses and a significant desire for nurses without paediatric experience to work in paediatric acute care services. Our idea is to create specialty trained and skilled paediatric nurses with an educational program to support their clinical transition.
This is about forecasting the right pathway to treatment and recovery for patients with musculoskeletal injuries. 30% of patients that get injured will go on to a very difficult and protracted period of recovery. While we're very good at treating these patients, we also still struggle with fashioning their care at an individual level when it is actually a multifactorial problem.
What we're seeking funding for is the implementation of a pain compass. Each of the layers within the compass represent different risk levels. In the black there, we have an individual's forecasted pain algorithm, and this indicates what domain their care pathway should be directed in.
So how do you measure something like a pathology of gait? Mostly we just use our eyes. We have to look at someone walking and go, using my knowledge of kinematics and biomechanics, I have to say what's going on, what's wrong and how can I fix it. It's very difficult to get an exact, accurate representation of what's going on with pathological gait.
So later on we found this BTSG ward in the market. This equipment is using a very small inertial sensor, and the sensor is connected to the software in the computer via the Bluetooth. The advantage of these equipments are actually the patient can be accessed anywhere, and also we can capture clear quantifiable information. So we can use this saving time to see more outpatient and shortening our outpatient waiting list.
We all swallow about every 30 to 60 seconds because we all swallow up to 900 times a day. For our patients, this is a luxury they don't have of swallowing with ease. FEES is fibre optic endoscopic evaluation of swallow. This equipment will help us visualise the swallow. It will help us guide our patients to make sure that their food and drink has been swallowed safely into lungs, into the stomach, and not aspirated into the lungs. I'm glad you are all listening. Half of our high-risk and complex patients can't access instrumental assessment on the day they need it. This is a flow-on effect that places increased demands on our hospitals, on beds, on length of stay, while our patients wait for a FEES. With your support of $38,000, we aim to become the statewide leaders in FEES. Our mission is to assess any patient at any time in any place to help them swallow with ease.
It's great to see that everyone's so patient-focused, that everyone's very innovative.
You can see what great ideas everyone has, so it's actually about them having a chance to implement those great ideas.
I think, particularly from a workforce point of view, it gives engaged staff the ability to maintain that interest and that drive.
Just to reaffirm what a wonderful series of presentations they were, absolutely fantastic. The Chief Executive gets to pick something, and I wanted to pick all of you. So don't get too comfortable, hard to swallow. Congratulations.
Awesome. It's just a fabulous opportunity for us to be able to get this equipment for our patients, also for our staff. It's been such a manual handling risk to push around that big bit of equipment we've had, so having something on an IV pole is going to be amazing.
So the winner, we can tell by the way you walk.
I think the main things the patient's outcome, the quality improvement for the long term, and also what happens is once we get another equipment, I believe actually we will be able to capture even better information to improve the patient service.